And rolling the show.
Welcome to Well Wellness. I'm Kara Barr, this is David Barr, and we're with Turning Point Wellness. And we're here today to talk to you about knee pain. In previous episodes, we've spoke about knee pain, some of the things that can be done. We're going to expand on that today and tell you even more information about knee pain treatments that your orthopedist might not tell you about. So, David, let's get started on that. What can you tell us about knee pain?
Okay, as you mentioned, there are lots of treatment strategies to help improve knee pain, and as well as some other conditions that we also look into treating, including some neuropathy as well. But when we talk about knee pain, you have to step back and say, okay, what's the root cause of the knee pain? So getting to the bottom of that is, first and foremost, one of the things that's most important. When we have somebody come in and said, hey, my knee has been bothering me, proper interview and physical exam becomes key in identifying, hey, what's going on and what can we do to help treat that condition. The most common form of knee pain is acute inflammatory reaction. And what does that actually mean? Well, the knee is all irritated and aggravated from either increased activities, excessive walking, running, different activities that involve a lot of strenuous work on the knees. Could be anything from construction to, hey, I've been building a pool in my backyard for the last 2 weeks, my knees have really started bothering me. Again, a lot of excess weight and or stress or activity on those knees. Most of those cases, people are complaining. We see simple things along with some proper rest, take care of that condition. And if we talk about medication-wise, we talk about something simple like some Advil, ibuprofen. As we get into more complex things that have become more chronic in nature, the most common chronic condition that we deal with when it comes to knee pain is certainly osteoarthritis. That typically develops for most people in their 40s and 50s, but has struck people as young as their 30s. We get into people that getting into their 60s and greater, we start to see that, quite honestly, 1 in every 3 people is affected by osteoarthritis in their knee, or one of their knees, or both. Whether it's severe or minor, but they are affected to a degree. Our first-line strategies for treating these conditions include, proper rest, maybe mild decrease in activity, limited, several weeks, maybe a month or so, but then the use of anti-inflammatories like ibuprofen, Advil, even Tylenol to help improve the pain. If those medications you can't tolerate very well, then we look at something along the lines of a Voltaren gel, which is the same as an ibuprofen, except it's a topical treatment that we use anywhere from 2 to 4 times a day to help control the pain, and that is placed directly over the knee joint where the pain's at. Ice can be very beneficial. We look into physical therapy to try and help improve the pain. One thing that a lot of people will tell you is, I'm having trouble doing a home exercise program or physical therapy because my knee hurts so bad. What can we do? Can we help reduce the pain before I get into doing those kinds of activities? And the answer is yes, absolutely. So, that being said, here at Turning Point Wellness, we have a lot of different strategies on trying to help improve your pain. Again, let's start with the basics that are done. Proper interview, physical exam to help identify what's going on, and what's important as well is simple x-rays. We don't necessarily need to get into the MRI world, But we do need to see some simple x-rays to see what are we talking about. Is there osteoarthritic changes? And that becomes important to note. So in almost every case, unless you have had recent x-rays, we get a set of x-rays. And the definition of recent is 6 months or sooner. So if your x-rays that you have are greater than 6 months old, or an MRI is greater than 6 months old, we typically want to repeat that just because things can change in that time frame, going from maybe a more mild osteoarthritic change to a more severe, moderate to severe change in the condition. It's important to note those things. After we've done a thorough history and physical, and we've gotten some of the x-ray results, that's when we sit down and we start discussing treatment options and strategies. We go through the things that you have done on your own. Have you utilized Advil? Have you utilized any prescription strength non-steroidal anti-inflammatories like a Mobic or a Celebrex or something along those lines? Have you used an over-the-counter Voltaren gel to help control your pain? Have you developed a home exercise program or done some formal physical therapy? When you come to us, most of the people that we see are the ones that have already tried a lot of these options. If you haven't, there's no reason why you can't come and see us and sit down and talk about these things. But these are certainly options you might want to do on your own ahead of time. Obviously, if you want to look into prescription strength medications like a Mobic or a Celebrex, or you want a prescription for physical therapy, then of course, please come see us. We'll make sure we get those started for you. There are, although not as frequent, there are alternatives used in many offices beyond those to help with the treatment of the painful conditions like osteoarthritis. One of the next steps that becomes important is we look into injection therapy. Now, this can vary depending on the types of therapies you've already done. A lot of people will come to me and say, hey, I've already had a steroid injection in my knee and it didn't do much good, or hey, it helped a lot, can we do another steroid injection? And I would sit back and say, well, let's talk through what you had done, when it was done, to see, is that our next most appropriate step? Steroids can only be used every 3 months. There is a lot of controversy with steroids right now, and there has been for a number of years. It does have side effects. For those that are diabetic, there is a chance that it will bump your sugar up, meaning that you'll need to adjust medications or increase your fluids to help combat that. With long-term use, we have seen softening of the bone and the joint, leading to an earlier onset of osteoporosis, which is certainly nothing that any of us really want to deal with. That is not what our bones need to be, have happening to them. So, is there a place for it? My answer to that would be yes, but I would quantify that with a very limited basis. There are other alternatives, and that's some of the things that we promote at Turning Point Wellness. There are alternatives to the steroids. There are medications like Trameal and Zeal, which are all natural anti-inflammatories. They can be done be utilized in either pill form or injection form into the actual knee joint, giving you similar results of decrease in inflammation and pain, but with far less side effects. They are very impressive. They've been used in Europe for decades. They are used in this country, and they've helped a lot of folks. The other thing that we can look into is hyaluronic acid. Now, again, that's fancy words for a combination of WD-40 and Pepto-Bismol. It's not actually what it is, but that's how it works. It is a lubricant to the knee joint. It helps lubricate the joint to make it easier to bend, and it helps coat the arthritic changes. It will not get rid of it or heal it, but it will help decrease the inflammation and help suppress the inflammatory reaction. When it comes to osteoarthritis, when it's affected the knee, there is nothing that is going to get rid of the arthritis itself short of a complete knee replacement. The things that we're talking about are, I will tell you flat out, that they are temporary. They will last anywhere from 4 to 6 months, particularly with the hyaluronic acids, but it can be repeated, and it can be repeated indefinitely to help improve pain. If it does help improve your pain and your mobility is there, is it necessary to have knee surgery? No. No. One of the best things you can do is have all of your original hardware, instead of having an artificial knee. There are risks involved with knee replacements, and many of you are sitting here going, yeah, I've had a friend. Most of us know at least one person that didn't have a real successful knee replacement, or they've had to have it revised. And keep in mind, your average knee replacement lasts 10 to 15 years. So if you're 50 years old, it's likely you'll go through a second one. So these are things to certainly consider. If you sit back and say, well, I've had that gel shot, or I've had that hyaluronic acid injection and it didn't help, and I had steroid and that didn't help, and I don't know what else to do, and is surgery my only option? The answer again is no. No, there is another treatment that can be done. This one is not as frequently used. It's becoming more and more popular with pain specialists that utilize this treatment. But many of you have heard that people talk about having injections into their back where the nerves have been, quote, burned, end quote, through a procedure called a radiofrequency ablation. All right. The radiofrequency ablation is a series of injections. It goes specific to the nerves that have been affected. In regards to the knee, there are 3 main nerves that control 85+% of the sensation to the knee. So those 3 nerves are the ones that are ablated. And a cannula is placed into the knee in 3 different specific areas. A probe is then sent down to the cannula and it lays over top of the knee. We do a test to make sure we're over top of the nerve. This is done under X-ray guidance. It can be done in an office. It's done in sterile technique. It is exceptionally impressive because once we identify the nerve, and then we identify that we're not over the motor portion of the nerve, we then, using pulsed radiofrequency, ablate or disrupt the pain receptor portion of the nerve. This, in effect, will knock out or knock down the pain. And let's be straightforward about the effectiveness of this treatment. What we see in greater than 80% of the people that have it done is a reduction of 50 to 60% of pain. This is average. Some more, some maybe a little bit less. But it lasts anywhere from 4 to 9 months. The average length of time is approximately 6 months. And it too can be repeated. The process starts as a test injection. Before we get to that level, we do 2 test injections. They're called genicular nerve blocks, where we just use a little bit of anesthetic, a little bit of lidocaine, and we look to see what amount of pain relief, if any, that you receive when we do a block to these nerves. Even if it's only for a couple hours, because it should only last a few hours, if you receive significant improvement, and that definition is ranged between 70 and 80% reduction in pain, and we do it twice, then we move on to the radiofrequency ablation. Again, good majority of the people receive a fair amount of pain relief. What we do that changes things a little bit is not only are we doing the block, but we are also utilizing a CBD Rich cream that we've developed and a CBD Rich oil that we've also developed that make a huge difference in helping to control the pain. When we utilize the cream and we have you doing physical therapy and utilizing ultrasound with the therapy, having done the radiofrequency ablation, we see a significant improvement of the pain. Most people, again, between 80 and 85%, seeing anywhere from a 60 to 70% reduction in pain. Makes a big difference. I know, Kara, you've utilized the cream and the oil and have seen a lot of the results from it, and have seen a lot of our patients that have had results from it.
Yep.
And I know that you can comment further with.
Oh, definitely. It's great for not only knee pain, but any joint or muscle ache that you would encounter. Even something like a headache. It will calm a headache down, whether you put it on your temples, behind your neck, the back of your head. It goes to calming all the aches and pains that you've got going on. So I've had a lot of great, anytime someone says I've got a pain, I'm like, let me give you a sample, because we've had such great results with it, and once you try it, most people love it. So so that's really interesting, what you talked about with the RF generator, and so that's something, is that readily available at other orthopedists? How does that work?
So what we see is the orthopedic surgeons are the ones that typically, or even primary care, typically refer to the pain specialist. Most of the orthopedists are not utilizing radiofrequency ablation. They are looking to do surgery. They're looking to do replacements. One thing I do kind of want to mention, and you're mentioning that a moment ago, made me think of this, is there are times that you may be a candidate for a knee replacement, but maybe your body habitus would not support it. Your weight is more than what it really needs to be to help with improving your outcome. A lot of orthopedists will look at you and say, hey, I'm sorry, but because of your weight, you're not really a candidate for this knee replacement because it won't support the excess weight that you have. Where we differ a little bit is the radiofrequency ablation. Yeah, that can be done even if you are a heavier set individual. And the best part about that is if I can get your knee pain better controlled, it's going to make you have more of an ability to be more active. If we can utilize our cream and oil combined with the radiofrequency ablation, it's going to help you become more active to do more activities, which in turn will help you lose some of that weight. Mentioning that we have a weight loss program as well that we could go into and discuss with you at that time. Certainly would be something that we would offer. Again, these are things that we can get to if that becomes a necessary part. There are also maybe folks out there that their heart isn't strong enough to have surgery, or their lungs, and the anesthesiologist is just not comfortable with using anesthesia to help obviously to put you to sleep to tolerate surgery. What do? The orthopedist said, sorry, can't help you, and the primary care is like, I'm out of options. To stay away from pain medications that have their own wonderful side effects, including the dizziness or the constipation, or just killing your energy levels. There's a lot of things that even medication just doesn't really help, or causes more side effects than what you may want to deal with. We have some treatment strategies. We have some options. For those of you sitting there going, well, I've had my knee replaced, but I still have pain. Is there anything for me? Is there anything I can do? The orthopedist wants me to do more physical therapy, and my primary care goes, I don't know what to do. This radiofrequency ablation treatment can be beneficial and help with knee pain for those of you that have had knee replacements and you're still not getting relief. That is a possibility. There are people sitting there going, well, I have rheumatoid arthritis in my knees and I don't know what to do. And the steroid injection doesn't help like it did. What do I have? What options are available for me? Again, the radiofrequency ablation can certainly make a difference. The cream and oil that we have can make a big difference. People that suffer from gout, this can make a difference. Combined with the creams and oils that we've discussed, yeah, there are strategies that can help you. Don't give up. Don't give up. Give us a call. Let us know. We will sit and talk you through. We'll figure out what's the best game plan for you. One thing that I'm super excited to share with you is that most, not all, but most insurances will cover the RF ablation, which is a really nice bonus. The cream and oil, no, because it's over the counter, but it's not super expensive. But the radiofrequency ablation, yeah, if the right steps are taken, it's covered by most insurances. We may need to get some prior auths, but we'll go over that with you if you come in with your insurance information. So there are alternatives, there are ways to get pain relief, and there are ways that your insurance company will help pay the bill. So that's a really nice bonus. One thing that I wanted to mention that made me think about this a little bit more as we were talking about our creams. One condition that we haven't talked much about, and I'd like to touch base on a little bit, is the neuropathy. When we talk about neuropathy in the legs and the feet, whether it's from diabetes or maybe chemotherapy induced, even alcohol induced, and then in some cases, well, something we call idiopathic, which means we're not quite sure what it is that's causing neuropathy in your feet and legs. Our creams and oils, along with some other treatment strategies that we have, can be very, very, very effective in improving that condition. But I guess one of the first things we should mention is what is neuropathy, and that is nerve endings. And the distal portion, typically at the knee level and below, that are inflamed and irritated, causing a painful numbness, burning sensation. I hear people talk about feeling like they're walking on hot glass. Those types of sensations. Very, very difficult to treat. The medications that are currently used are not the greatest. They have not such fun side effects. We have strategies combining our cream and oil with shockwave therapy, with hyperbaric treatments that can be extremely effective. There are some all-natural prescription strength medications that don't get utilized as often as they should, including medications called metonics and photonics that can be very effective in helping treating these conditions. Obviously, if it's diabetic neuropathy, a good control of your diabetes becomes very important. But we do have other alternatives for things like the chemotherapy-induced, even alcohol-induced, or idiopathic neuropathies that can really make a difference. The diabetes, let's talk about getting your sugars in check. And again, even with them being in check, we know that this can happen. We can certainly utilize our cream and oil. The shockwave therapy is exceptionally impressive, particularly when we deal with the scar tissue that can develop from the chronic neuropathy. Hyperbaric chamber. After 6 to 8 treatments is when we start seeing new blood vessels to those areas. After we've disrupted and, kind of irritated the scar tissue area of the neuropathy within the knees, within the lower leg and feet, we see an inflammatory reaction. We combine that with hyperbaric medicine, which will respond to that inflammatory action by creating new blood vessels, which will increase stem cell activity to those areas, helping to heal the condition, we start to see a significant reduction in pain. Most of the time, we can see anywhere from a 30 to even up to 40, 50% reduction in pain with utilizing our cream and oil on a daily basis, and these treatments for anywhere from 5 to 7 weeks with the hyperbaric chamber and the shockwave therapy, and then giving the body a break for 3 to 4 months, we can get quite a bit of results. A couple times a year, you can see quite a bit of relief. So let us know. Give us a call. Let us see what we can do. We're using some non-traditional as well as very traditional therapies to help improve your pain. Let us know. We can certainly help with your pain. Kara, anything that you might like to add at the end here?
No, I think our goal is to help groups of people that have not had help through traditional means. We're offering treatments that aren't readily available just everywhere. So we love it when patients come to us with a difficult treatment, like neuropathy. So often it's just, it's just, that's your situation. We can't do much about it. But we've developed treatments. We have options that patients can try, and it's so rewarding to see someone who has previously been told that there's really nothing that could be done for them, that we say, we've got options. We want to try to help you, and we do see positive. We might not be able to completely knock out the pain or the discomfort or whatever their ailment is, but we can make strides and improve the situation for them, and that's really when it seems like there's no options, even an improvement is dramatic for the patient.
Agreed.
So thank you for joining us today on Well Wellness, and we look forward to seeing you again next time. Give us a call at Turning Point Wellness. We'd love to be a part of your solution.